Holly. And I'm going to say tuberculosis. Thank you, Holly, and thank you all for joining us for today's briefing on the release of a new CDC vital signs. I'm Benjamin Haynes, Director of Media Relations for CDC, and we are joined by our speakers, Dr. Deborah Howry, CDC's Chief Medical Officer, and Dr. Hank Tomlinson, Director of CDC's Division of Global HIV and Tuberculosis. I will now turn the call over to Dr. Howry.
Well, good afternoon, everyone, and thank you for joining us today. For more than 30 years, CDC has been at the forefront of the fight against HIV in the United States and around the world. In 1981, CDC reported the first known case of what would later be called AIDS and the Morbidity and Mortality Weekly Report. From these earliest days, CDC has been a leader in the domestic and global HIV response, bringing a combination of scientific and technical expertise to the fight against one of the world's deadliest infectious diseases. The U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, was announced in 2003 by President George Bush and was the largest commitment by any nation to address a single disease in history. At the time, in many countries across the world, lack of access to life-saving HIV treatment and weak health systems meant that an HIV diagnosis almost certainly led to death. Today, I am pleased to share a new CDC vital signs report that examines the impact of PEPFAR's nearly 20-year-long efforts to bring life-saving HIV treatment to people around the world. The most comprehensive study of its kind, this report shows PEPFAR's HIV treatment efforts have dramatically transformed the global HIV epidemic in less than 2 decades. CDC has played a crucial role, leveraging our scientific expertise, technical know-how, and strong relationships with ministries of health to accelerate HIV treatment and prevention worldwide. In fact, the study shows that CDC and its government and non-governmental partners are responsible for the majority of PEPFAR treatment outcomes worldwide. Starting in 2004, PEPFAR began efforts to expand HIV treatment for people living with HIV. Effective HIV treatment not only helps those with HIV live longer, healthier lives, it can also prevent transmission of the virus to sexual partners and reduce the risk of HIV transmission from mothers to children. This, in turn, reduces new infections overall. Increasing access to effective HIV treatment is critical to efforts to eliminate HIV as a global public health threat. This is treatment as prevention. CDC and PEPFAR's efforts have expanded access to life-saving treatment, increased the numbers of people living with HIV who have achieved viral suppression, and bolstered health systems across the globe. These efforts have reduced the number of new HIV infections and deaths, saving lives and making the world a safer place. Despite these tremendous achievements, significant gaps remain. Fueled by unequal access to life-saving HIV services, CDC's work is centered on addressing these inequities head-on. As an emergency physician, I have seen firsthand the impact infectious disease can have on individuals, families, and communities. I still remember the early days of HIV and my time in the emergency department, often diagnosing HIV in very late stages in patients and not having many tools or treatments for these patients. This new report shows us just how much progress has been made, but it also shows us there is still much work to be done to close critical gaps in reaching certain populations who continue to be left behind due to health inequities. Moving forward under PEPFAR's current 5-year strategy, the United States aims to eliminate HIV as a global public health threat by 2030, while strengthening public health systems to respond to other global health crises. We're excited about these new data showing CDC's significant contributions to the fight against HIV globally and how PEPFAR's efforts overall have dramatically altered the trajectory of this epidemic. To achieve this goal by 2030, we must sustain this momentum. I will now turn it over to Dr. Hank Tomlinson to share findings from the report.
Thank you, Dr. Oury. When the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, was announced in 2003, HIV was a global crisis, devastating families, communities, and economies worldwide, particularly in sub-Saharan Africa. At the time, an estimated 30 million people in Africa were living with HIV, yet only 50,000 of these individuals were receiving HIV treatment. And since 2004, PEPFAR has been a driving force in the global response to HIV by supporting partner countries' scale-up of treatment for people living with HIV. The Vital Signs report, published today, shows that since 2004, the number of people receiving life-saving HIV treatment through PEPFAR increased an astonishing 300-fold, from just 66,500 individuals in 2004 to more than 20 million people in 2022. Additionally, The analysis found that between 2015 and 2022, the percentage of people receiving HIV treatment through PEPFAR who had a viral load test and achieved viral suppression increased from 80% to 95%. Virally suppressed refers to people who, thanks to treatment, have their virus under control. And this can prevent transmission of HIV to sexual partners and helps reduce the risk of transmission from mothers to children. Researchers also compared findings from large CDC-supported household surveys in 6 African countries severely affected by HIV and found similar increases in population viral load suppression rates between 2015 and 2021. These surveys, known as population-based HIV impact assessments, or PHIAs, showed that viral load suppression rates among the populations increased in Eswatini, Lesotho, Malawi, Uganda, Zambia, and Zimbabwe. Results ranged from a 13 percentage point increase in Lesotho to a 19 percentage point increase in Malawi. And despite these achievements, the analysis also revealed significant gaps. The authors note that several groups have been and continue to be left behind due to ongoing health inequities. While viral load suppression rates reach 95% overall, certain groups, including individuals who are pregnant and breastfeeding, children, and people living in prisons, have yet to achieve comparable rates. Data drawn from the PHIA surveys also showed population viral load suppression rates were lower in men who have sex with men compared to women, and lower in young people when compared to older people. Addressing health inequities in access to HIV care and treatment has been a core principle of PEPFAR since it began, and CDC is deeply committed to advancing health equity, including in our efforts to end the global HIV epidemic. HIV particularly affects people who are discriminated against or stigmatized, and eliminating HIV as a global public health threat demands that we understand and address the root causes of health disparities, including stigma, discrimination, and social inequities. These disparities create barriers to accessing life-saving HIV treatment and prevention services. And not directly addressing health equity issues will only hamper progress in eliminating HIV. The report's findings also affirm that PEPFAR has not only made tremendous gains in the global response to the HIV epidemic, but also strengthened the systems that keep the world safe from other global health threats. CDC has been a leader in these efforts at every step. And CDC and its partners are responsible for the majority of PEPFAR treatment efforts by supporting 62% of all people living with HIV on PEPFAR-supported antiretroviral therapy. CDC is also leading global efforts to scale up viral load testings by setting quality standards, establishing infrastructure, and expanding and enhancing laboratory testing. Our work on the front lines, strengthening laboratory systems, training and supporting healthcare workers, and enhancing disease monitoring systems helps countries better respond to HIV while also preparing them for future health threats. The Vital Signs study revealed that in countries around the world, existing PEPFAR systems have proven invaluable to the COVID-19 pandemic response. In one analysis, from April 2020 to March 2021, 109 PEPFAR-supported HIV laboratories and 138 HIV and TB sites in 16 countries conducted over 3 million tests to diagnose COVID-19. Results from the Vital Signs study show that we've made immense progress in the global HIV response. Today, PEPFAR investments are managing a chronic disease at an unprecedented scale. By providing effective treatment, PEPFAR's investments are helping drive down new HIV infections and deaths. For example, in Uganda, one of the first countries supported by PEPFAR, efforts to expand life-saving HIV treatment have prevented over 600,000 deaths related to HIV and nearly 500,000 HIV infections since 2004. And from 2011 through 2016, Eswatini's rate of new HIV infections was cut nearly in half, and its national rate of HIV viral load suppression doubled. In Nigeria, the number of people newly diagnosed with HIV who started HIV treatment increased 8-fold in just 18 months, even in the midst of the COVID-19 pandemic. So today's findings underscore the critical need to build on these accomplishments and address remaining gaps if we are to eliminate HIV as a global public health threat once and for all. Now I'll turn it back over to you, Ben.
Thank you, Dr. Tomlinson. Holly, we are ready to open up for questions.
Thank you. If you would like to ask a question, please unmute your phone, press *1, and record your first and last name slowly and clearly when prompted. To withdraw your request, please press *2. It'll take a few moments for questions to come in. Please stand by. And our first question is from Carmen Pon with Politico. You may go ahead.
Hi, thank you so much. Can you hear me?
We can hear
Hi,
you.
can
Go
you hear
ahead.
me? Okay, thank you so much. Just on the issues of inequities, which are so crucial to, achieving the 2030 goal, what exactly is CDC looking at doing? We know that in many of the countries still fighting HIV, in some cases, men who have sex with men are criminalized. There's very little access to healthcare for pregnant women and for teenage girls. What exactly is the CDC doing or planning to do to reach this group?
Sure, I'll take that. Thanks for the question. So I think that we recognize that persistent inequities are likely the result of a number of determinants of health. Those might be social, economic, geographic, or demographic. And the first thing that we at CDC try to do is to understand where, among whom, when, and how HIV infections and negative outcomes for people living with HIV exist. That helps us understand how to design and deliver and over time improve services to make sure that populations and groups that need them most are in receipt of them. In addition to that sort of understanding of epidemiology and how a disease is characterized, we also work to address the inequities at a variety of levels. And so at an individual level, we want to design programs and deliver services that really have people and patients at their center and make them accessible, desirable, and available to people to participate in. If you move beyond that to the facility and service delivery setting, we're trying to work on reducing stigma and discrimination among service providers. And then we're also trying to work through, in a variety of prevention and other services, some of the structural and other key barriers that I mentioned earlier.
Holly, our next question, please.
And I currently have no more questions at this time, but again, if you would like to ask a question, please press *1.
So if there are no further questions, I'd like to turn it back to Dr. Alry to close us out.
We do have a couple more questions. Do you want to take those now?
Yes, let's take them.
Okay. Our next question is from Ariel Freire with Axios. You may go ahead.
Thank you so much. I'm curious how important the requested increase in funding to CDC's budget is going to be to combat HIV and AIDS worldwide.
Thanks for that question. And so generally, PEPFAR and agencies that implement global HIV programs have received an aggregate level of funding over the last decade that has been flat. Of those, CDC receives approximately $2.1 billion per year. And we hope that we will continue to receive bicameral, bipartisan support for reauthorization and in future appropriations. I think that at this level of support, we'll be able to continue to maintain the gains that we've seen, to continue to aggressively and rapidly try and address the remaining gaps, and to shore up systems that will make sure that these are durable gains seen over time.
Holly, if we have another question, we'll take it.
Yes, we have a few more questions. Our next one comes from Apurva Mendavili with the New York Times. You may go ahead.
Hi, thanks for taking my question. My question is, how many lives do you think PEPFAR has saved? I know that the $20 million is for ART, but I'm sure there's a sort of ripple effect. And how do you estimate the number of lives saved?
Yeah, thank you for that question. And so I'll say that PEPFAR as an enterprise acknowledges that at its 20th anniversary, there are 20 million people that PEPFAR and its partners support on life-saving antiretroviral therapy, and go beyond that to say that there are an estimated 25 million lives saved. I mentioned some of the specific modeling that have been done in Uganda, which is published in an earlier CDC report this year. That's one example, but the numbers for the enterprise are 20 million on ART and an estimated 25 million lives saved.
Our next question, please.
Yeah. And our next question is from Tom Rosenthal with Infectious Disease Special Edition. You may go ahead.
Thanks for taking my question. What from PEPFAR, what have you learned and are learning that you can apply to dealing with other epidemics and pandemics?
Thanks for that question. This is really critical today. And we think while PEPFAR has been an unequivocal success in changing the course of the global HIV epidemic, PEPFAR investments in HIV have also had broad benefit for global health security. So benefit beyond HIV. And whether that's investing in laboratory systems and settings and activities, which are what we use during the time of an infectious disease outbreak to diagnose or understand what a thing is, to the disease monitoring systems that we use to characterize initial outbreaks or burgeoning epidemics. PEPFAR's investment in these in the 55 countries where PEPFAR has worked can be used and are every year used for benefit outside of HIV. The workforce that we support, almost 370,000 people across PEPFAR service delivery settings and through PEPFAR partners, have been called upon during COVID-19 and during other recent pandemics to make sure that prevention activities are delivered, that medical countermeasures are delivered, and that information and data are collected and feed into planning and response to the greatest degree possible. So while made in the context of HIV, these have broad benefit and improve health security.
And I would just add to that, you know, at CDC, our mission is to protect the public 24/7. And we've learned from COVID, Zika, and Ebola that disease has no borders. And this is why it's so important that both our domestic work and our global work hand in hand. As Dr. Tomlinson said, strengthening lab systems, healthcare systems, working with healthcare providers, reducing stigma, as well as the surveillance work that we're doing. All of this protects our U.S. citizens domestically and abroad, and really improves health security globally.
Our next question, please.
Our next question is from Carmen Pon with Politico. You may go ahead.
Hi, thank you so much for allowing me to ask a second question. Just in terms of financing, we saw the president's budget actually propose a sort of like $25 million cut in the money that goes to the State Department for PEPFAR. Obviously, we don't know what the final figures will look like, but I was wondering if that goes through as it is, if you would expect a drop in the number of people that PEPFAR is supporting, or any negative consequences for the program.
So I think that with our successes, we've also become very efficient over time and really good stewards of taxpayer resources. And so while We have a request in. We hope that that process will work itself out favorably. We will make sure to do the absolute best that we can with the resources that do flow to us.
Thank you. That was our final question. I would now like to turn it over to Dr. Alry for closing remarks.
Thank you. Well, for nearly 20 years, looking back on that, an HIV diagnosis in many countries almost certainly meant death. Yet today, more than 20 million people worldwide are leading healthy, productive lives thanks to the life-saving treatment they received through PEPFAR. But the race to end HIV is far from over. Today, more than 38 million people worldwide are living with HIV, and each year, 1.5 million people newly acquire an HIV infection. More than 4 decades ago, since the first cases were reported, HIV is still a leading cause of death and a health threat to millions around the world. Significant gaps remain in our efforts to reach certain groups with critically needed HIV treatment services, including youth, men, and other key populations such as gay and bisexual men, female sex workers, people who inject drugs, people living in prisons, and transgender people, primarily transgender women. We've come a long way in addressing the global HIV epidemic. Eliminating HIV as a global public health threat is within our grasp. We must stay the course so that these decades of progress aren't reversed. PEPFAR's 5-year strategy is a powerful roadmap to help us get there by 2030. It reminds us that as a global health community, we must sustain HIV treatment and prevention efforts and investments, address health equities head-on, strengthen public health systems, and harness our shared commitment to bring an end to the global HIV epidemic once and for all. Thank you.
Thank you, Drs. Alry and Tomlinson, for joining us today. I would also like to thank our American Sign Language interpreter, Sarah Lynn Guillory, for her assistance. We will put the graphics back on the screen for a few minutes for those who want to record them. For follow-up questions, please call the main press office at 404-639-3286, or you can email media@cdc.gov. Thank you for joining us. This will conclude our briefing.